Speech and language therapy is definitely a growing field in Kenya. Parents and medical professionals alike are discovering the benefits that speech therapy has in optimizing communication and swallowing outcomes in children as well as in adults. Hi, my name is Lorna Muthamia-Ochido, and I am a pioneering Kenyan speech and language therapist. I've been practicing in Kenya for the past nearly 8 years, and I began my practice my career in Australia and New Zealand, which is the same places that I actually studied in. I recall my early months back being quite frustrating because there was very little that was known about the profession in the country, and medical professionals that had to make do with that vacuum. For children who presented with speech and language difficulties, perhaps the recommendation then was, expose your child more to other children, take them to a school or a play group. That was what they could recommend because there wasn't that many speech therapists. But the good news is that currently a child or adult who requires speech therapy, or at least in Nairobi, can access the service quite readily. One of the goals I've had as a pioneering speech therapist in Kenya has been to raise awareness of our profession and empower our patients, particularly our parents. This has enabled my practice to be, the biggest provider of speech therapy services in not just Kenya, but in East and Central Africa. This has also been made possible through partnerships with not just the families and the clients, but also with key medical professionals that have played integral roles in not just referring patients, but also being involved in a multidisciplinary approach to intervention for those patients. Some of the key health professionals speech therapists work with include audiologists, pediatricians, ENTs, neurologists, neurodevelopmental specialists, as well as other allied health professionals. In order to circumvent the severe shortage of speech therapists in the country, I have had to devise a sustainable model of service delivery, which involves training speech therapist assistants. Through this model, which is already one that is used in various Western countries, we are able to see upwards of 600 patients per month. And that is still astounding to me because the need is still so great. So far, we've been able to help over 10,000 families and been instrumental in helping a significant number of adults post-CVAs to improve their quality of lives as well as repair communication breakdowns. So speech therapists normally specialize in various areas, but in Kenya, because of the shortage, it is not unusual to hear speech therapists refer to themselves as being generalists. So the persons experiencing the following conditions can be referred for our services. Children particularly who have speech difficulties. So those are articulation or pronunciation issues. So a child that is saying tap instead of cup. Children that stutter or stammer, as well as children that have dyspraxia or developmental verbal dyspraxia. Children can also be referred that have language difficulties or delays, and these could be relating to how well they are understanding, so receptive language skills or expressive language skills, how well they are expressing themselves or talking. So basically the speech difficulties is to do with the mechanics, and the language difficulties is to do with the output. Children with literacy issues, what is commonly referred to as dyslexia or slow reading progress, can also be referred for our services. Children with auditory processing difficulties, so this could manifest as attention deficit issues, or children that are known to have chronic otitis media. So chronic middle ear issues usually might end up having or experiencing auditory processing issues. Of course, children with hearing impairment, congenital, as well as this could be sensory neuro or conductive. Voice disorders as well can be referred. So some of the red flags for referral of speech and language issues is a child who by 18 months does not have between 25 and 50 words. By 24 months or 2 years does not have between 100 to 300 words. Or by 3 years does not have 900 words. The following etiologies can result in speech and language issues. Developmental disorders such as autism spectrum disorder or reading disorders genetic conditions such as Down syndrome, other syndromes such as Fragile X, neurological dysfunction such as cerebral palsy or strokes, and oral anomalies, so like cleft lip and palate. It is well documented that there is faster progress if therapy or intervention is offered at the earliest possible instance. And although this age is becoming much younger from when I started my practice back 8 years ago, we are still getting children that are coming to us at ages 3 years or even above. And this is normally through self-referrals. If more and more specialists were able to refer children at ages 2 years or even younger for those children that are known to have had congenital issues or suffered birth trauma, then we'll be in a much better position to improve outcomes for a lot more children and empower parents to act within the critical brain development period of their children, which is 0 to 3 years. For adults who have experienced CVAs and have dysphasia, dysarthria, or dyspraxia, speech therapists can normally work to improve communication or even swallowing skills. The closer that they seek speech therapy to the incidents that the CVAs. For adults who have voice disorders, speech therapists can play an important role in teaching strategies that improve voice quality, as well as offer voice hygiene that can prevent further deterioration of their voice qualities. For adults who stammer or stutter, speech therapy can also play a very big part in improving their fluency. For the adult population, however, motivation plays a key part in how soon or how quickly we can realize outcomes for them. Speech therapists also work in the multidisciplinary management of acute patients, particularly with regards to tracheostomy care or the transition of feeding of patients with trach tubes, or also with overall swallow assessment and management. Speech therapists who are qualified and who specialize in this field are able to assess and determine when it's safe for a patient to have solid food or thin fluids, and this in order to reduce the risk of aspiration. Speech therapists qualified in this area can also conduct video fluoroscopies to assess swallow function and safety in patients. The benefits of speech therapists stretch far and wide. For children who should be referred, children that have had birth trauma, so mom experienced prolonged labor or obstructed labor, perhaps the delivery was through emergency CS, and who at 18 months or 24 months has notable delayed speech or no speech at all. So children as well who have delayed motorical milestones, such as not sitting by the time they are between 5 and 7 months, not walking between 9 to 14 months, not talking by 24 months, so these are the speech milestones, or not combining words by the time they're 2.5 years. So these are all red flags for speech and language issues. Children that are born with congenital conditions such as Down syndrome, cerebral palsy, cleft lip and palate, of course, must be referred as well. And children that have suspected attention deficit or hyperactivity disorder. So these are children that ordinarily you feel as well are not staying still when they're coming for their review with you, or jumping up and down all over the place. They need to be referred for speech therapy. So children who have chronic or recurring colds, these are notorious for causing conductive hearing loss, and children need to have optimal hearing skills for them to develop good speech skills and language skills as well. A child that has a stammer, they need to be referred at the earliest instance, because prognostically, if the time that the therapy is offered or intervention is sought is closer to when the onset of the stutter happened, then we are able to manage this child's stutter a lot faster. And any child that is suspected to be on the autism spectrum or any other pervasive developmental disorder needs to be referred for speech therapy, or at least an evaluation. Just like my clinic has managed to assist over 10,000 families, I am confident that we can work together for the benefit of the patient. I look forward to working together to improve communication and swallow outcomes for your patient.